Oh, sorry. Okay. Can you see my my slides in presenters mode?
Yes, we can.
Yes.
Okay, great. All right. So just want to say a huge thank you to Karen and Jeffrey and Tiffany and to OHC. And it's a great pleasure to be talking to you all today on something that's so important to all of us. And I'll just give you a bit of background. I am an occupational hygienist, and I'll explain what an occupational hygienist does in a minute. I've got about 30 years experience in occupational hygiene. Before I was an occupational hygienist, I was an industrial chemist. So my training is actually in chemistry. Yeah, I've been doing this for about 30 years. So I've worked for industry and the government in Queensland, Australia, and also in Newfoundland. I've also been working for the Occupational Health Clinics for Ontario workers for about 5 or 6 years now. And yeah, we do very similar work, and sort of projects that I'm involved with there. There's the Mcintyre powder project that you may have heard of, where what they did for decades was actually expose miners to aluminum powder. They thought that it would prevent silicosis. So we've been doing a lot of research in that area. I'll just tell you about what an occupational hygienist is. So typically we help employers understand how health hazards affect the health of workers, how significant the risks may be, and advise on reducing those risks by identifying suitable controls. We frequently work as part of a multidisciplinary team, including occupational health physicians, health nurses, and other health and safety professionals. So we're trained and we have the skills to identify and assess and find solutions to control workplace health hazards and thereby manage any associated risk to health. So these may be chemical, physical, biological, or ergonomic, and can be present in the workplace in many forms. We also use trusted sources of information and evidence to guide and support the advice we provide. And I'll be doing that today when I talk to you. And I'm kind of very wary, you know, we're all being bombarded with information from the Public Health Agency of Canada and the different public health organizations within our provinces. And there's just so much information at the moment. I'll try to kind of navigate through it as an occupational hygienist and just share some of the things that I've learned since the start of the pandemic. So I apologize in advance. Some of this is going to be technical and some of it's going to be general, but I really want to try and get your attention for the whole of the webinar so you can go away and at least have some idea of where to go with what I share with you. Just a bit about the Occupational Health Clinics for Ontario workers. We're very lucky, we're an interdisciplinary team. So we do have the luxury of working with ergonomists, medicine physicians, occupational health nurses. We have quite a few occupational hygienists in a number of clinics. So we do network very well. And, you know, somebody asked me a question, for example, then I might, if I don't understand the question, or if I can't come back with an answer, I haven't got the knowledge, then I might reach out to one of my colleagues. I'm also the past president of Workplace Health Without Borders. So Workplace Health Without Borders, a bit like Doctors Without Borders in the early days, although I say early days, we've been going for about 10 years now. I'm still on the board of directors and I meet with them regularly. So this is my volunteer job. And I just wanted to put a plug in for Workplace Health Without Borders. We're all trying to do the best that we can to share the best information to navigate through this terrible situation we're in. So On the 31st of January, we're presenting on respiratory protection for COVID-19. And we've got a guy called Stephen Verpalis. This is an international group. We have about 1,000 members on our circulation list. We have branches in the US, the UK, Australia. We've got close alliances with Africa through Africa and other countries. So we've actually, quite interestingly enough, we've got about 333 people registered so far, and many of them from Africa. So we've got Stephen Verpalis talking about the ISO standard for respiratory detection in emergency use for a pandemic. We've got Dr. Simon Smith, who's going to be talking about Canadian standards and international relevance to bioaerosol protection. We've got Stacey Richardson from 3M, talk about how to get a good fit with your respirator. And Jen McDonald, who's an emergency doctor here in Ontario, she's got some good hints on do-it-yourself fit testing. So we're part of, through WHWB and also OHCOW, we're part of a collaboration, and we also a bigger collaboration network. We collaborate with the World Health Network, and you might want to have a look at their site. They provide some really good infographics on COVID and how to prevent infection. And I just want to mention that there is a webinar presented through the Occupational Health Clinics for Ontario workers. So Val Wolf, who's also a participant with me in this webinar, and others have been working on a number of webinars. And I believe we've provided over about 23 webinars. So you might want to kind of look at the link here and then look at past webinars that have been delivered. But this is the webinar planned for Friday, January the 28th, so next Friday between 1 and 3, which will talk about rapid testing, use, limitations and equity, rapid testing, reliability and false positives, lessons from the front line in the community, and lessons from the front line in the emergency department. So we're very fortunate to have Dr. Kashif Prasada, who's a co-founder of Masks for Canada. He's going to share his experience on the front line there. But you might want to go and see some of the past webinars. We've had a huge range of speakers, both in Canada and internationally. So I've got the OHCOW webinar series, and also Workplace Health Without Borders. We have a YouTube channel, and you can actually look at the WHWB YouTube channel, and you can sort of see some past presentations from the international speakers we've had there. And I just want to acknowledge Alec Farquhar, who sort of coordinates a coalition that both Val and I belong to. It's the Canadian Aerosol Transmission Coalition. We really do a lot of advocacy to push the science hard. So, you know, the best prevention measures are put out there into workplaces above and beyond what we're hearing from public health. And with Workplace Health Without Borders, we actually co-sponsored a letter with the Aerosol Coalition on the spread of COVID. So this is a letter that was sent to Teresa Tam, Patty Haiju, premiers and medical officers in the provinces back in January the 4th, 2021, so close to a year ago now. I won't go through it, but most of these recommendations to the government were around ventilation and also respiratory protective equipment. You can actually go back and have a look at that letter if you like. Masks for Canada, another really good grassroots organisation, part of our coalition, and there's some really good information there, infographics that you can go through and look at, what the different kind of face covers look like and where the respirators fit in the face covers. Also, just with the World Health Network, there's some good infographics there as well. So as an occupational hygienist, or industrial hygienist as they say in North America, I actually am Australian as well. So we call industrial hygienists, occupational hygienists in Australia, and also closely linked with the Australian Institute of Occupational Hygienists. But if you have a look on the web, you'll see that there's quite a few resources from the AIHA. It's an American organization of industrial hygienists, and also the ACGI, it's the American Conference of Governmental Industrial Hygienists. There's also an organization called CIDRAP, the Centre for Infectious Disease Research and Policy. It's another trusted source or site, and they also have some really fabulous information. And I just did a quick screenshot of this, and I just noticed, maybe other people have noted this, but you know, talking about the White House to offer 400 million free N95s to Americans. As part of our coalition, we also have emergency doctors, Sarah Adderman and Jennifer McDonald, who are really are stalwarts, you know, and advocates in this area. And this is a paper that was published back in September in the Canadian Medical Association Journal. If you look at the literature, there is a study from Hong Kong where 2 people were in a hotel. They're in a quarantine hotel. They really didn't come in close contact with each other. They're in separate rooms. But what they found was that even in separate rooms across a corridor, one person quarantined infected another. So, you know, the evidence is quite clear now. Coronavirus is airborne. So, you know, if you think about that as we move forward, it really makes us think about what we need to do to prevent exposure and how important ventilation is. So this webinar, you know, typically we think of the hierarchy of control with respirators as the last line of protection, but it really doesn't fit well with the pandemic, because if you think about a respirator, it acts as both source control and personal protective equipment. So, you know, it's part of the layering of preventative measures. So I'll talk a bit about that. I also want to talk about international standards and good practices. I want to talk about a process flow roadmap to determine where and what type of improved ventilation is required. You know, and ventilation doesn't stand on its own. It's kind of well linked to respiratory protective equipment. And I'll talk a bit about how that is so. I want to introduce the Occupational Health Clinics for Ontario Workers Ventilation Calculator. It's really a tool that a fellow occupational hygienist from the Hamilton Clinic, John Udick put together. And there is going to be a follow-up workshop as a follow-up to this on February the 11th from 1 to 3 p.m. And I'll talk briefly about that. So during the breakout sessions, we're just really looking for real-world examples. So what, you know, I've got you for a while, and I just want to make it very clear, this isn't going to provide enough training to make you an expert on ventilation, but it will hopefully give you a better understanding of what to look for, risk assessment improvements by using the OHCOW ventilation checklist, and also provide an introduction to a more in-depth follow-up workshop using the OHCOW ventilation calculator. And this is courtesy of John Udick again, who really does some fantastic work for OHCOW, and this is his kind of conceptual model about the prevention framework. So all of these layers are important, and if you think about personal protection, being vaccination, having a tight mask, preferably a respirator, group protections, you know, test cohort, reroute, reschedule, organization protections, ventilation, extra filtering and cleaning, sectoral protections, unique specific practices, and societal protections, so vaccinated masks, remote work. So once again, you see that the respirator mask is blue, and also the respirator mask is red. So it's, you know, source control and also personal protective equipment. Yeah, so as I said, that both ventilation and filtering face piece respirators or N95s are essential protective layers for airborne precautions. I just want to also mention that as an occupational hygienist, you know, we love measuring things. You know, what gets measured gets noticed. What gets noticed gets action. So I really want to spend a bit of time talking about the importance of measuring carbon dioxide, but it's another tool in the toolbox. This is on a plane coming back from Costa Rica. And I was just curious to know what the carbon dioxide levels were in the plane. But, you know, I guess, you know, before anybody goes out and measures carbon dioxide, if they're not familiar with it, there's a lot of limitations in how you measure it. And, you know, I highly recommend that if you do that, talk to an occupational hygienist first, or, you know, ventilation engineer who has experience in this area, because you can actually get a false reading. So this was close to me, so it might have been picking up some of my breath. But, you know, in any case, it was elevated. And there is a scientist from the US, Dr. Lisa Brossu, who said, no one to my knowledge has correlated carbon dioxide with particle concentrations, which is quite right. And I guess the biggest problem with relying on carbon dioxide as a surrogate for ventilation is that it tells you very little about air patterns in a room, which are much more important than people seem to recognize. You know, especially if there are dead or recirculating zones, the number of air changes may not have any impact on that. So I just want to make that clear. You know, if you think about using CO2, you know, and you act as required to improve ventilation, the target levels of less than, really you want to aim for less than 800 ppm, but definitely no more than 1,000 ppm. You know, there's a kind of an expression, start with the end in mind. There's going to be a lot of workplaces that won't get under 1,000, but if we keep measuring and improving, then hopefully they will. And it's really about, you know, starting off with the worst performers and talking about improvements to ventilation there. I've also provided a link to an air purifier calculator for schools. So, and I'll talk a bit more about that as well. The reason that I've got it alongside of carbon dioxide monitoring, carbon dioxide's a gas, and you can filter the air and still have high levels of carbon dioxide. So don't get fooled. But if there's no filtration, there's high levels, then if you do have a high level, then what that tells you is you probably do need to filter the air. This is just a caption from a French website talking about the importance of trying to maintain carbon dioxide below 1,000 ppm. There's also other issues with carbon dioxide being above 1,000 ppm, you know, other than just being, you know, kind of a quasi-indicator that the ventilation is inadequate. That is, if it's not filtered for COVID. There's also cognitive problems with children in schools. They talk about loss of concentration and fatigue and headaches. So getting less than 1,000 ppm, it's just good practice. In New Zealand, the ministry also planned to bring carbon dioxide monitors as part of a ventilation toolkit for schools. But there are a range of risk calculators available as well. This is one that we've just come across from the AIHA. We're still trying to get a head around. I haven't really used it, but they will get published in the Journal of Occupational Environmental Hygiene, so stay tuned to that. There's also the Occupational Health Clinics for Ontario Rural Workers Classroom Ventilation Calculation Tool, which I'll talk about in a minute. There's also a risk matrix developed by the British Occupational Hygiene Society to help guide control options. And I won't go through that, but you might want to have a look at that. And it's a simple tool to follow. I do want to kind of talk about the Harvard Healthy Buildings Risk Calculator. So Joseph Allen has actually presented through Workplace Health Without Borders, and they've got some really good information on their website around ventilation in schools, and it includes this risk calculator. And the thing I like about this risk calculator is that you've got these kind of bars here with a little red piece here that you can actually pull either way, depending on, it's more kind of like a qualitative assessment, if you like. But it gives you it does a risk assessment, and you put in different kinds of controls. So you basically look at the number of people in a room, the size of a room. You look at face coverings, personal habits, room cleaning, social distancing, natural room ventilation, air cleaning and UV disinfection. And you can actually do a calculation on the level of risk. And I found that just by putting an N95 covering, very likely reduced the 11% transmission risk to less than 1%. So you might want to play around with that yourself. So the new OHCOW ventilation tool that we're working on at the moment, what I have done here is just provided a link to a presentation provided by John Udick, and it's really designed for schools, and it was actually given to teachers in schools. And the idea is that they do an assessment and they can post the assessment on the outside of the classroom. So there is a link to the YouTube video provided by John. And as I said, we'll be following up, we'll be providing a follow-up workshop on it. This is what the tool looks like. You go through different steps in using the tool. And this is the Excel spreadsheet. It's a calculator, and it basically gives you a total equivalent of air changes per hour. We want to aim for more than 6 air changes per hour, somewhere between 6 and 12 air changes per hour. We also want to aim for less than 800 ppm carbon dioxide in our assessment. Now onto the OHCOW ventilation checklist. Just check the time. Okay, so the ventilation checklist was put together probably close to about 1.5 years ago now. It was actually based on courtrooms reopening. So we kind of, that was the lens that we were looking through when we put it together. It is quite old, and it is being modified to incorporate the latest good practices pertaining to ventilation. So what I'm going to step you through is kind of like a revised version, if you like, of the checklist, but you'll look at the website, you'll see that it's not the same as what I present, but hopefully in the near future we'll place what's in there with this one once we kind of finalize it. It's available in both English and French. Okay, so I'm just going to go through the questions. I don't know if there's any HVAC technicians or ventilation engineers on this call or this webinar, but it's really important that we do check in with the person in charge of the day-to-day operation of the heating, ventilating, and air conditioning system. Questions like ask about the status of the HVAC system. Is it running properly? What service does it need? And there's a number of things that we can ask the HVAC technician there just to get a feel for how good it is. Now, this is kind of scalable for really big operations. I highly recommend that you engage with an occupational hygienist, preferably certified, and a ventilation engineer, a P engineering engineer, depending on the scale of operations. So this is just a guide or a checklist that you would probably take to the building owner and the ventilation maintenance people to go through through the lens of an occupational hygienist, an occupational health scientist. So there's a link to the core recommendations by ASHRAE. ASHRAE is the American Society of Heating, Refrigerating, and Air Conditioning Engineers, and you'll see that there's a number of coronavirus response resources in that. So it's just all background information that you can provide moving forward. What I've introduced into the checklist is the process around doing a risk assessment. It's really important. You know, for example, if the province provides so many air purifiers, how do we know which schools and classrooms those air purifiers go in? And so there really needs to be some kind of risk ranking process, you know, where the poorer performers have an air purifier. In some situations, you question whether those classrooms even be occupied until the ventilation's improved. But, you know, just thinking about the risk factors, closed spaces, poor ventilation, many people, many minutes, you know, that's the kind of signals that there's something wrong. I've just taken this out of Japan, actually, early on in the piece. We're communicating what they call the 3 C's, so as risk factors. So closed spaces with poor ventilation, crowded places with many people nearby, and close contact settings such as close range conversation. But what I've also included in this, so you see where the circles overlap, the red in the middle. Also think about duration, the time spent in these locations and activity, such as heavy exercise gyms. But obviously, you know, if there's a higher community transmission, then the risk will be so much greater again. I can't remember which province it was, whether it was Newfoundland or Ontario, but, you know, reopening different places. And I heard they were reopening gyms. And I kind of think about, you know, the level of exposure from heavy exercise being so much greater than just, you know, other occupancies. We do have a colleague, Ryan Ingrand, who it's one of these kind of people that he's taken it on himself. He's a biostatistician. He has a website and he does his own monitoring. Actually, he provides a dashboard, and you can actually look at his dashboard and you can get an idea of the risk between all the different provinces. But I guess, you know, where with contact tracing not being done the way it was before, you kind of, it's going to be really hard to gauge where the higher risks are. Dr. Lisa Brossu, as I said, she's also an occupational hygienist from the US, and she's been a great leader in the field. And you know, she's been leading a team through the ACGIH, and so they've actually come up with it's an old process of stratifying the risk. It's called controlled banding. But controlled banding can help identify infection risks and interventions. So this is a table that you can look at, and so basically you look at exposure level and hours per day. So the number 1, if you look at that that table there, and you can actually think about with COVID, and you can think about the likely exposure and how long you're exposed. So what I might just kind of say to you all, I might just kind of get you to reflect on this a bit. Which band would a teacher fall into? I guess, you know, there are going to be children infected in schools, so there will be likely exposure. And typically a teacher works more than 3 hours per day. So I would kind of put that in the C, but please, if anybody disagrees with me, maybe just put something in the chat box. But I just think that's where I put it, but you know, different people will have different viewpoints on this. So then if we go across to the prioritized source and pathway controls to minimize exposure, a C, we need to control exposure, control emission at the source. So typically, you want a tight fitting mask, preferably a respirator, and 995 respirator pathway. That's where ventilation comes in. So we really want to improve the ventilation. And receiver, once again, we want the receiver, possibly a teacher, to also have a tight fitting mask, preferably a respirator. Oh, can't see that. It's kind of hiding the screen. So really, the American Conference of Governmental Industrial Hygienists has released these white papers, and they've been revised June 2021. So as I'm going through this checklist, I'm thinking of all the things in these white papers and have we included them in the checklist. And really, we should be aiming for industrial settings to have the air changes per hour greater than 6. Increase the filtration efficiency, dilution of air in the form of displacement ventilation should be introduced into the facility at lower velocities near floor level wherever possible, whenever possible. We really don't want a lot of turbulence. You don't want to stir the air up too much. We want good mixing, but we don't want a lot of turbulence. We need to focus on restrooms, make sure the fans are operating continuously and exhausted directly outdoors with exhausts away from the facility ventilation supply intakes. And the airflow direction should be from cleaner air to less clean air. Diffuse large air currents by directing or blocking the flow stream. And then the next point there is positive pressurization. And so this guide actually talks about a water gauge for pressurization. There's another white paper. This is actually for non-industrial, non-healthcare settings. This is for public and private schools, theatres, commercial buildings, and public buildings such as courthouses. It doesn't address engineering controls for healthcare facilities. It is not intended for use of engineering controls. Sorry, it is not intended for use of engineering controls, including ventilation in residence, either single or multi-family. So it is ventilation control in non-industrial, but not for residents. It's a good technical supporting document with useful schematics, definitions, and descriptions of different types of ventilation, including both general ventilation, displacement, and dilution, with also a description about how to avoid turbulence, which is so important. We want good mixing in the air. Also includes a good section on filtration, including higher efficiency filters, and the importance of properly installed face loading filter frames arranged in built-up filter racks. And I might talk a bit more about that in a minute. I think I might have a slide that talks about that. But we did have a presenter through OHCOW, Professor Jeffrey Siegel from the University of Toronto. And he is an expert in this area. And he said that one of the shortfalls of putting filters in to filter out recirculated air is the housings that they actually sit in, and there can be the bypass of air around the outside of the filter bank. So it's really important that an inspection be done there. I also wanted to just revisit carbon dioxide. It is a really great tool, and I'm seeing a lot of my colleagues now hold this monitor up that I have as well, and they basically carry it around with them. But it's just a useful guide to understand what the ventilation's like. And this is the Aranet 4 monitor that I used. This actually can be Bluetooth to an iPhone, and you can actually measure the carbon dioxide, and you can actually see the graph in real time to see how there's an increase of carbon dioxide. This was actually in a coffee shop, and I was just interested to know what was going on. I did speak to the guy working in the coffee shop. He did open the window, and he did open the front door, and the carbon dioxide did come down. And I did note that he changed his respirator actually, or his face covering, which was a cloth mask, to a KN95. It's a Chinese respirator, but it's got ear loops. Yeah, I just thought I'd show that again. I think it's a useful graphic. And for the people that want to do more with carbon dioxide monitoring, you can actually measure carbon dioxide. So, for example, in a school, if it's occupied, at the end of the day, if you leave the CO2 monitor, just after the full occupancy and leave it there for the night, you will see this decay curve, and you probably wouldn't do it once. You might do it, say, 5 nights in a row to get an average, but it gives you a good estimate of the air changes per hour. And so I've just put a calculation there, a decay curve calculation. It's just a very useful guide for working out ACHs. The World Health Organization, since the checklist, has provided an amazing document. It's called the World Health Organization Roadmap in How to Improve Ventilation. And it does actually take you through a decision pathway of yes/no questions to figure out what you need to do with the ventilation. So I've actually included this in the checklist. I think this document should be consulted moving forward. The AIHA also has a engineering controls guide, and there's just a schematic here showing how important it is to have both good air changes per hour and N95 respirators at the same time. I'm not going to really go through all of the text here. I've basically just taken what I've got in the, but we really need to increase the ventilation rates, or the percentage of outdoor air that circulates into the system. We want to try and make sure that the system's operating continuously. So, for those systems that have carbon dioxide monitors built into the system to regulate the system, you can actually change the set point of CO2 so that it does operate consistently. And you might want to adjust the dampers so you get more fresh air. And the idea is to especially look at ventilation systems in washrooms, the exhaust fans. Try and keep them on all the time. And also make sure the windows are closed, because you want to have the washroom under negative pressure. You want to create a vacuum there. So you want air to be drawn in there. If you leave the window open, then the air will probably bypass and the fan won't work properly. But if it's not, if you don't have a fan, it's very difficult. It's important to keep all the windows in the building open as much as you can. And the more windows you have, the more cross flows that you generate throughout the building. And even, if you just put some windows 1 inch or 2 up, and a few of them will make a difference. So really, just, you don't want to stir the air up, but you also want to try and exhaust the air. So one helpful strategy is to use a window fan placed safely and securely in a window to exhaust room air to the outdoors. So as you exhaust to the outdoors through the window, then when you have other windows open, the air will be drawn in, fresh air will be drawn in through the other windows. So yeah, as I said, you can turn off demand control, ventilation controls that provide more supply air. And I know many of you out there are thinking, we're in Canada, it's cold. It's easier said than done, but it's kind of a balancing act. And I did talk about inspecting filter housings, where the filters, the recirculated air filters are installed. And also looking at, inspecting and maintaining exhaust ventilation systems in areas such as kitchens, cooking areas. Operate the systems anytime these spaces are occupied. Operate in them even when the specific space is not occupied will increase overall ventilation with the occupied building. Now, it's really important that we think about air purifiers. They're another barrier. And if you think about, where it's impossible to bring in more fresh air, through mechanical ventilation, these standalone portable filters will be useful. And, having listened to a few webinars and spoken to a few ventilation engineers. Upper room ventilation, sorry, upper room ultraviolet systems can be used to provide air cleaning within occupied spaces. I'll talk a bit about that more in a minute. So I think what also is important, you know, if you think about a building being shut down, if you think about, you know, air conditioning systems and, you know, stagnant water, it could be a potential growth of Legionella. So, you know, once you restart a system, this is something to be very well to be aware of, and you might need to think about extra disinfection of the water system before you restart it. So what I have done is actually in the checklist I've included what are the air changes per hour for each room. So that will be a question, and this is there is a calculator, as I said, and I've just looked at different, this is courtesy of John Udick again, thanks to John, where he's compared different air change rates and looked at different carbon dioxide concentrations. But we need to be aiming for 6 to 12 air changes per hour, and you know, try and get it less than 600 preferably, but you know, there's a probable problem between 800 and 1,000. Yeah, we talked about increasing outdoor ventilation, providing more fresh air outside where the risk is, especially where the risk is greater. You've got more children, more people, you really need to get more fresh air into the building. There's an excellent article in the Synergist, and it's provides another checklist, if you like, that you can go through by a guy called Jeff Burton that I might refer you to. But you know, he talks about checking all supply and return grills and registers, and checking outdoor air intakes. And also, we talked about washrooms. Airflow direction is very important. And you know, talked about constant supply and recirculation air. And I've just provided like a snapshot of all the different filter ratings. So we're looking for a MERV filter greater than 13. But you've got to be careful, because if you put too high a MERV rating filter in, there might be increased pressure in the system as well. So I guess, you know, can more windows be opened? And what I'm reading is that you can actually assign a COVID guardian, like every hour for 10 minutes, open a window. So you just assign somebody to open a window every 10 minutes. We've talked about filters being put in properly, making sure there's a seal around the filter. And I've just provided a hyperlink there to information to Jeff Siegel. I just think also, you know, we don't really want more than one person to occupy a room. And this is just something I came across where there's just kind of like a line on the floor there to say, please keep your distance. But there was another room in the building where there was actually a half cut off door. And so it actually stopped the person coming into the room. There's a lot of information in here on portable air cleaners. I won't go through it, but there's a link to Marketplace here where a number of portable air cleaners were looked at and tested, and you know, the do-it-yourself box fan with an added filter is actually quite good, and I'll talk a bit about that in a minute. But I guess if another message I want to make here is just to avoid air purifiers with ionizers. Ionizers can generate ozone, and they can also generate byproducts. So, you know, if you've got an ionizer, just avoid these add-ons. You just want something that filters the air. And I've just provided a link here to Clean Air Crew. It's a fabulous site that provides a lot more information about portable air cleaners. And also there's a link to the OHCOW webinar that Jim Rosenthal from the Cozy Rosenthal box presented. So the guy that actually developed this with Richard Corsi actually presented through OHCOW. I get you to watch that and look at the clean air crew information. This is just some background information. Everybody can do it themselves. Like you can actually go to Canadian Tire, buy the equipment, get the box fan, get the filters. Could get a 3M 1900 filter. You can make the box yourself, and I used cardboard on the bottom there, and you put the box fan on the top, and then you put duct tape around it. I actually donated to my son's school, and the principal actually was glad to accept it, and she said that she would put it in my son's classroom. So, you know, you might want to look at this and think about what you can do yourself to clean the air. There's also important that the inspection and maintenance of commercial building HVAC systems is carried out, and I've just provided a link to a standard for doing that. People might ask whether additional duct cleaning is required. What I'm reading is that it's not, so you can read that yourself. And I think, you know, as part of the system of maintenance, you know, we also have an obligation to make sure that the maintenance personnel have done a risk assessment before they do that anyway. We talked about carbon dioxide. There's a lot of caveats and limitations, and I've just provided a link to a UK document that will provide more there. So really, we want to increase the ventilation rate. That's the first thing we want to do. We also want to increase the filtration efficiency. So, you know, where we can provide or maximize outdoor air ventilation, we want to think about the air being recirculated into the room. We want to filter that air. And then, you know, then we can look at supplementing with portable air cleaners. And this is just a useful triangle from Harvard. But, you know, if you think about respirators and ventilation, they are linked. They're not standalone barriers. And the Canadian standard for selection, use and care of respirators does that. It actually looks at the ventilation, and it figures out what kind of respirator you should wear based on the level of ventilation. And in some high, and I guess I've just put in here that elastomeric half mask respirators are better. There's one study that I know of that demonstrates they will provide a better fit. And they're more cost effective. But then in some situations, in higher risk settings for healthcare workers, you know, powered air purifying respirators will be required. And this is kind of a busy schematic, if you like, but this is in the Canadian standard. But there is a way that you can actually step through and figure out what kind of respirator you need based on the risk group, the generation rate, and the control level. So if you think about teachers, for example, with children, it really doesn't go any lower than an N95 respirator, an air purifying respirator. I'll just leave that with you. And there's also from the IRSST, there's a tool, an online tool that steps you through how to select a respirator for bioaerosols. So just closing up, depending on the scale of operation, engage an occupational hygienist. We have a number of them at OHCOW. We do take inquiries, and we also have colleagues that are professional engineers. Consult with a building owner and heating, ventilation, and air conditioning technician, and maintenance provider. I think it's really important that we carry out risk assessments to identify buildings, rooms where improved ventilation is required. Follow this ventilation checklist to identify what to look for. And also, I suggest that you, if you're really interested, to actually go through the OHCOW ventilation calculator and even join the webinar when we do that to actually drill down to determine air changes per hour for each room. And I just came across this schematic, and sorry, there's a lot of information there, but you know, it really does talk about providing more outside air, more natural ventilation, including MERV 13 filters, carrying out carbon dioxide monitoring, and providing portable air cleaners. So this is kind of just a schematic that talks about where you might put the air cleaner compared to the children. So basically, it filters the air and pushes the air upwards, and then it's captured. And that's it. Thanks for your time. Back to you, Jeffrey.
Okay. Thank you, Kevin. That was a tremendous boost in, I think, a lot of our knowledge and understanding on this really important topic. It's a little bit of information overload. There's been some questions about whether your slides would be available for folks, like in maybe a PDF format.
Yeah, I'll change them. I'll save them as a PDF and then email them to you, Jeffrey, and
that would be
Tiffany
great.
and Karen. Yeah, okay.
Thank you. So thanks everyone for sticking with us. We hope nobody has left just yet. I'm going to switch here to my other slide deck, and we're going to continue now with the next part of our event. And that's going to be breakouts. So give me just 1 second here. Always learning how double screens work. Okay. There we go. Okay. So just a little bit of a background for why we're doing this. The plan is to break out into groups, and these are going to be random groups. And we're hoping that there's going to be some really good discussions around these 4 questions. You can see them on your screen here. And at the OHC, we just believe really strongly in workplaces kind of putting their thinking caps together and thinking hard about a problem or shared concern. And certainly ventilation, indoor air quality is something that every workplace, if you work indoors, it continues to be an issue even with or without COVID. I think COVID has certainly brought this to the forefront as an even bigger issue, but I know indoor air quality has been something that industrial hygienists and those who work in the health and safety field have been calling on action for quite some time. So we're hoping we can learn from each other. And the way this works is there's going to be a facilitator, an OHC staff person or someone from OHCOW attending the group. And there'll be anywhere from 5 to 7. I think it's going to be 3 groups of 5 and 1 group of 7. And the plan is your facilitator is going to provide a link to you to what's called a shared Google document. If you're familiar with how that works, there'll be a link that they'll share with you, and you can click on it and open it up, and anyone can view these 4 questions. And whether your group decides to elect, hopefully someone to maybe take some notes, or if you choose to just have folks type it in themselves, that's all right, however you decide to work the format. But the plan is over the next half hour is to go through these 4 questions as best you can, especially the piece around assessment and looking at maybe some improvements that you've identified that need to happen. And I think Kevin has provided quite a bit of great starter material to think a little more intently about how you could do that as a health and safety committee or as another expert in your particular workplace whose job it is to look at this. You can reflect also on what are some other things during the presentation that you found most useful, but we also want you to report back, especially on question 4, which are what are some other questions that have been generated from your discussion, but also question number 2, which is about the improvements that you've identified and maybe some ideas on how to do that. So don't feel like you have to report back on all 4 questions. Those 2 bolded ones, number 2 and number 4, are kind of the key ones we'd like to hear from folks. So we're going to break up into groups of 5 or 7. And I'm just going to look here to see if I missed any piece. Karen, if you find anything that I missed on this part, let me know. If you are, just a technical note, if you are disconnected for some odd reason or you can't get into the group, we will be kind of hosting a group in the main room. So you'll still have a place. If you do get booted out of Zoom entirely, try that link again. We've got people on tap here to help you find your original original group. So I'm just going to take note of the time. It's 2:04 by my phone. And once again, if you have any questions, direct them to your group at this point. We didn't have any come through the chat line today, and that's all right. I'm hoping that means everyone was intensely listening and maybe taking their own notes. But we're hoping that we can kind of churn some good thinking here, and we'll come back at 2:30 to do a larger group discussion, and Kevin will be on stage to help us work through some of these questions. So without further ado, I'm going to have Tiffany go ahead and break us out into our various groups.
So just give you the update, Kevin and Jeffrey. So since, we got quite a few participants already left, they have some other commitment. So you could find that your group is relatively small, just including yourself, probably just only 3 person in one group. So, but this is the case, but we're going to open up 5 rooms. Okay. Is there any issues? It's all good. Then
that should work.
Okay. So enjoy your discussion there. Okay. See you guys later. Hi, Kevin. I like your presentation. Really good. So,
Thank
Lisa,
you.
are you still there?
There's a lot of detail there.
Yeah, Lisa says she's not going to join the breakout because she has another commitment. That's why I put her still on the main room. She texted me earlier. Yeah. Okay. Wow. And you just only have 1 person with him. My goodness.
That's good. It's, there's an old saying, dance as though nobody's in the room. And, I've given lots of presentations to hundreds and hundreds, and I've given presentations to a few, but it doesn't make any difference. You're still name effort in.
So Andrew,
I only have Ron Ireland. So can you send him to another group, please?
Sure. Let me see. What is his name? Ron, is it?
Ireland.
Ron, I'm going to how come I cannot?
You don't see him?
I see him here, but I cannot move him. Move to maybe number 2. There you go. I move him.
Bye, Ron. Okay, Holly is connected. I just admitted Holly. Can you put her somewhere, please?
Holly, we are just starting the breakout room. So I'm going to assign you to one of the room. Are you okay?
Yeah.
Okay, I may want her to be at group 3. How come just only, okay, maybe 1, 2, 4.
One, two, three. 1, 2, 3.
There you go. There you go.
Woody and me. 1, 2, 3, 4, and 1, 2.
Yeah. Yeah.
I got a chat from that Ernie Romaniak in room 5 saying he does not have a microphone at his workplace.
Oh,
so I
really?
think him and Valerie might be chatting, or who's doing room 5?
Oh, room 5 just only Wow and maybe can we have Wow and Ernie staying in the main room here when we could talk? You know what I mean, right? I feel bad, have them, come. Okay, I'm going to let them know.
For you.
Hi,
Hi, Tiffany.